Complementary and alternative medicine covers a broad range of healing philosophies and approaches, targeted for the whole person, including physical, mental, emotional, and spiritual aspects. Visual artist and corporate manager Kate Sakala used this approach as a complement to Western medicine. A few years ago, Kate was recovering from a second surgery procedure and chemotherapy for uterine and ovarian cancer. While her cancer was in remission, other problems occurred.
It was about a year after radiation treatment that I started having some bad after effects from the radiation. The tissue that had been radiated began to ulcerate and basically die, which was very painful, of course. I was urged to have surgery to fix this. It just felt like it was so soon after all of the other treatment. I just didn't want to go through another surgery. And I thought I would just wait and see. So that left me basically taking morphine and bedridden for months. And I finally decided I'd had enough of that and I would give in and have the surgery. I looked at my calendar and I saw that I had a doctor's appointment in about 1 month and decided, okay, I'll give it 1 month and I'll try some alternative therapies for 1 month, and if it didn't work, then I would go for the surgery at that point. I had decided to try acupuncture and visualization for my alternative program. A lot of patients were having acupuncture to combat the effects of chemotherapy and radiation. In my case, I felt it really helped alleviate the pain and advance my healing a great deal.
Kate initially came to me 4 years ago, and we began working with creating a meditative state of mind. And then once she was able to achieve this deeper state of relaxation, we began to incorporate imagery.
The visualization I found very powerful in that it combined a type of hypnosis with one's own healing images. Patient and I put together a script of images that felt powerful and felt very personal and positive. And that, listening to that script in combination with being in a somewhat of a hypnotic state, I feel is very powerful in getting one's subconscious to cooperate with one's healing process.
When you use imagery, what you are doing is communicating with your subconscious mind, because your subconscious mind only understands imagery. The body doesn't know the difference between the reality and your imagination.
The cancer and chemotherapy treatment had exerted great trauma on Kate's body, producing numerous problems. The radiation had destroyed tissues in her intestines and colon area, causing ulcers to form, resulting in great pain. During the same period of time, Kate was going to her acupuncturist 3 times a week and doing visualization twice a day. Kate fared well using acupuncture and visualization, noticing changes in the first 3 weeks and major improvement over the next 6 months.
Basically, healing had begun and things started turning around for me. At some point I totally dropped the morphine medication, which totally amazed her. And the healing amazed her. She basically said that she had never seen what she called a spontaneous healing. I don't think it was quite so spontaneous as you might think of spontaneous. I think it was just that it didn't have a medical intervention and yet was healing. And she had never seen that occur in radiation damage. When I was diagnosed with cancer, I was working on average 6 days a week, and my life was pretty much revolving around work, managing a company. Having cancer changes your perspective, and I realized at that point that I wanted to diversify my life. I needed more interests, more time with friends and family, and more time to relax.
Kate turned her attention to her artwork and began painting and sculpting as a way to express herself and the experience of what she was going through.
I tried to stay very non-pressured about my artwork and just let it evolve. I don't worry about the results. I just let the expression come forth. My artwork gives me an opportunity to express what I feel and an outlet for feelings I've dealt with in fighting cancer. I wouldn't use the alternative therapies as a primary tool against cancer. If my cancer was to return, I would go for surgery or chemotherapy or radiation. But I do believe that the alternative therapies can be used to help the body heal and to maintain and recover balance in the body. They can be powerful. But again, I would use it as a complement to Western medicine.